This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share this week's update on the COVID-19 pandemic for the week of June 28th, 2020. As you know, we've been following the global number of deaths since mid-April for this pandemic that began apparently in January or late 2019. Every week we've seen an increase in the number of global deaths. And unfortunately, this week we've reached two rather unfortunate milestones. The first, that there has been over 500,000 deaths in the world, and now over 10 million confirmed cases. In terms of following the United States, we've been doing the same thing. It began in the US in late March. By mid-April, when we started looking at it, it was 45,000 deaths. It's been increasing consistently every week since then, such that by June 28th, we've had 128,000 deaths and 2.5 million confirmed cases. Now, sometimes raw numbers don't communicate much. So what I did was I looked at how many deaths we would have expected in the United States from the 10 leading causes of death. So we're halfway through the year, and this is how many deaths we would have expected from the 10 leading causes of death. And that's right where COVID-19 be. This is a very, very serious cause of death in our country today. Now, as you know, I like to look at deaths per million. And so from April, we've been comparing the US to other countries, and we've watched everyone's deaths per million go up, especially the US, such that we are now almost well over halfway to where Belgium was when it began. But this is what I really want to show you. These are the leading, the 20 most heavily impacted countries in the world for total deaths per million. All right, and 25 leading countries in the world for deaths per million. The ones in blue are North America, the ones in pink are South America, and over these weeks we've been watching South America grow. But now what I want to do is I want to compare this to what change we've seen in the past month. And what we've seen is that almost the South American and North American countries are growing much more quickly. These are percentage growths. So 100% for Peru means it's doubled in the last month alone. So we're seeing this very significant growth in countries with previously lower rates. This is a chart that I created that compares deaths per million across the bottom to percent change in the last month. And what you can see is that those countries that are relatively new, relatively lower numbers, are seeing the greatest growth rate. And I'm going to come back to that in a minute, because now I want to talk about the United States. As you know, we've been following deaths per million, and week to week, the growth rate has been dropping pretty consistently until this week. And now we've seen an increase in the dropping growth rate, which suggests that we may be seeing a resurgence or a spread of this pandemic in the United States. It's a little early to say anything definitively, except to say that clearly the growth rate isn't going down, the growth rate in number of deaths. We followed hospitalizations as well, and that has been dropping, but again, staying relatively stable. Now, this follows, the hospitalization data is about a week later than death data, so we'll have to wait another week and see, but it clearly looks like for both hospitalizations and death, the U.S. is starting to see a little bit of a resurgence. Here are all 50 states for their deaths per million, and this is really remarkable data. Obviously look in the Northeast and you see those high numbers, all the way down to Hawaii and Alaska, where they're about 1/100th of what we're seeing in the Northeast. Now, if you color code this by region, pink is the Northeast, blue is the Midwest, yellow is the South, and white is the West. And you can clearly see that we have much higher rates in the Northeast and perhaps secondarily in the Midwest, followed by the South, followed by the West. Now, unfortunately, we don't have historic data on all 50 states. We only have it for 27 states, but these are the ones we have. But this is what I want to show you again. What's happened in the past month? And here again, you can see those states that had the highest rates before are now seeing the lowest growth rates. And those states, particularly in the South and the West, which were relatively low before, are seeing the greatest percentage increase. And just as we saw with Europe, we see this high increase in those states with the lowest previous numbers. Now, this idea that the most impacted countries and states are growing the slowest might be relevant. It might be irrelevant because there's really four possible reasons. One, we could see growth rates that are lower in those most heavily impacted states and countries because the people there have seen the severe impact of the pandemic and they're more willing to self-isolate, socially distance, wear masks, and so on. If that's the case, then once they open up, we're going to see spread again. A second possible reason is that the pandemic may have struck larger cities that have greater population density. And this does two things. One, obviously, SARS-CoV-2 spreads rapidly when there's high population density. And because these cities are so large, they have a disproportionate impact on the total population of that country. The third possible reason that we may be seeing lower rates in the heavily impacted countries and states is perhaps there's some ultimate size to the pandemic. And there's no evidence of this yet, except to say that if you look at New Jersey with a rate of 1.1699 per million, that's about a 0.17% death rate, which is getting close to what some have estimated the SARS-CoV death rate is at 0.3. And then it's possible that there's some combination of the above. But clearly in the US, it looks like we're starting to see increased deaths, increased hospitalizations, but we're not exactly sure what's going on. So it's something we need to follow. There's a lot more information on COVID-19 at our college webpage. Please go there and cruise around. There's some new things we've added this week. And if you have any questions, please don't hesitate to let me know. I'd be happy to try to find some answers for you.